Hello everyone. This week we will describe what stimulant substances are, and their effects on humans. We will identify epidemiological patterns, related to the use and misuse of different stimulant substances. We will discuss the potential risks, associated with polydrug use. And we will define key terms and concepts related to the use of stimulant substances. There exist many forms of stimulant substances. Some of them are legal and unregulated in the United States, like coffee and tea. Others are semi-regulated, like tobacco, or highly regulated, like methamphetamine, which is illegal to manufacture, distribute, or possess. Many stimulant substances are synthetically produced, many others occur in nature and have the ability to increase alertness, attention, and energy. Chewing betel nuts or coca leaves are not usually included in reports of psychoactive substance use or misuse, despite these practices having potentially significant public health consequences, such as oral cancers. We will explore the most commonly used and misused of the stimulant substances. Most stimulant substances trigger the sympathetic nervous system to a state of arousal, as if an event warranting a fight or flight stress response truly exists. They do this through their influence on two neurotransmitters, epinephrine and norepinephrine. Together these two neurotransmitters play a role in the body's stress response. Epinephrine is also known as adrenaline and norepinephrine as noradrenaline. Other effects include being more alert and focused, feeling more pleasure. Feeling more nervous and having increased sexual libido are other effects of stimulants. However, stimulant use can also lead to irritability and hallucinations, high blood pressure, disrupted sleep, tremors, and psychosis. Amphetamines are synthetically produced drugs that are a subject of concern related to prescription abuse, just like opioids. They are often prescribed for ADHD. They increase dopamine levels in the brain, a neurotransmitter responsible for cognitive alertness. This dopamine release improves attention, motivation, and ability to focus. Methamphetamine is a specific form of synthetically manufactured amphetamine. Vast amounts of methamphetamine are produced in illegal, foreign, or clandestine labs. Methamphetamine street names include meth, ice, crystal, crystal meth, and glass. Methamphetamine has a high addictive potential. Methamphetamine use is associated with an increased risk of stroke. Methamphetamine use can have devastating effects on a person's dental health, resulting in severe tooth decay and gum disease, broken teeth, and tooth loss, sometimes called meth mouth. Cocaine is a stimulant substance that also has anesthetic properties, and a long history of use, and misuse, in the United States. It is derived from a naturally occurring source, plants in the erythroxylum group that include coca. Cocaine has various street names. Some of them relate to different forms, powder or crystal. For example, coke, crack, blow, and snow. Freebasing refers to heating and smoking a processed crystal form of cocaine, crack. Speedballing refers to the practice of combining cocaine with heroin. Cocaine use leads to quick and intense psychoactive effects. It is usually snorted, smoked, or injected, but may be rubbed on gums to be absorbed. As with many other potentially addictive substances, the intensity of the dopamine, brain reward response to cocaine, is far greater than is elicited endogenously from engaging in natural pleasure behaviors. The consequences of cocaine use include bleeding within the brain, cognitive deficits in attention, memory, impulse control, and motor actions. The caffeine is included in the lecture because it is believed to be the stimulant and possibly the drug, which is most widely used globally. Caffeine is present in many forms of tea, coffee, chocolate, and energy products. Withdrawal from caffeine is linked with headache, fatigue, drowsiness, irritability, difficulty with concentration, and nausea, and muscle pain. Tea is derived from the leaves of tea plants. Tea contains caffeine, matcha tea has more caffeine in it. Coffee is produced from the beans of coffee plants. Caffeine content in a coffee beverage is highly dependent on the type of coffee. Caffeine is present in the beans of cacao trees, from which chocolate is produced. In general, the darker the chocolate, the greater its caffeine content. White chocolate is produced from cocoa butter in the cocoa bean, rather than from chocolate solids, cacao nibs. Therefore, it does not have the dark brown color of the bean, and also does not have caffeine. A tremendous amount of caffeine consumption occurs with certain types of soft drinks, including the diverse class of energy drinks and energy shots. Leaves of the tobacco plant also can produce a stimulant effect when chewed, sniffed, or smoked. Smoking tobacco or nicotine-containing products include cigarettes, cigars, pipe, hookah, and e-cigarettes, also known as vaping. You have to be 21 to buy tobacco products. Nicotine has a relatively high addictive potential, being quickly absorbed, causing the release of epinephrine and activating the brain's dopamine reward circuits. Tobacco smoke contributes to a host of physical health problems and diseases such as lung, oral, and other cancers. Chronic bronchitis and emphysema. Heart disease. Heart attack. Stroke. Type 2 diabetes. Cataracts. Poor pregnancy outcomes. And chronic obstructive pulmonary disease. Withdrawal symptoms include difficulty with paying attention, irritability, disordered sleep, increased appetite, and intense nicotine craving. E-cigarettes are considered safer, but they might also lead to cancer. Vaping often results in transitioning to the use of regular cigarettes. How common is stimulant misuse? According to the 2018 National Survey of Drug Use and Health, about 6.6% of Americans engage in stimulant drug use every year. This is not counting caffeine and tobacco. 40 million persons aged 12 and older have used cocaine during their lifetime. Cocaine use is more common among males, and among those who self-identify with white race or ethnicity. An estimated 14.9 million persons aged 12 and older have used methamphetamine during their lifetime. Over 90% of adults in the U.S. regularly use caffeine. 168 million individuals aged 12 and over, or 61.5%, have used tobacco products during their lifetime.